Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications, which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
I'm Adrian Steele, I'm 61 years of age and I'm Leicester born and bred. Married with two grown-up sons, one 32, the other 28, and we're a very close family. My sons are both boomerangs, they keep coming back, and it's great because we are very close and we're good mates. We also have a dog, a 7-year-old Labrador, who's been a great support and has helped me through all of this. I am a retired senior manager. I worked at Alliance and Leicester for 35 years in IT, but I'm not a techie. And I had the opportunity in 2007 to take early retirement, and I did, looking forward to lots of holidays and a great life. But in February 2008, along came the diagnosis of cancer. That came along following a stay in hospital of 3 days where I was taken in with severe stomach pains, chest pains, etc., which reminded me very much of pains that I had in 2000 when I had a heart attack, and that was followed 6 weeks later by a pulmonary embolism. Anyway, I was taken into hospital and went through some tests for 3 or 4 days, which seemed like an eternity, and was given my diagnosis of kidney cancer, which came as a bolt out of the blue, and it was given to me by, I think he was just a radiologist. Say just, that's not bringing down radiologists or anything, but there's a guy dressed in jeans and t-shirt who said to me, "You've got kidney cancer, mate, but we can get rid of that, just get rid of the kidney."
Adrian Steele has come in today and he's kindly agreed to tell us about his diagnosis, which was a kidney cancer, if I can say that at the start.
Yep.
Although you've had your share of complications and, let's say, information and sometimes incorrect information, I think, along the way.
That's right.
But I heard you say there about your medical history prior to the diagnosis, so maybe it'd be worth telling people about that, because they'll be able to compare those symptoms with what happened with the kidney cancer symptoms. So if we take that incident, the illness in 2000, what happened then in brief?
Briefly, I was sitting at my desk at work and I suddenly felt very sweaty and weak, and I managed to get up and go to the gents, almost fell over on the way, and I was taken to the sick room, and someone said, well, let's get an ambulance. I said, no, I'm okay, I'm fine. But I did reluctantly agree to go and see my GP, and went to see him, and he took my blood pressure and various other tests that he could do in the surgery, and told me that it was probably just a virus, and some antibiotics would clear it. That night, I remember it well, it was a Friday night. I had very, very little sleep, and the next morning I was in a lot of pain, and I was really throwing myself against a bedroom wall because I was in that much pain. My wife called out emergency doctor, who came out and said, no, it's a virus, it's definitely not cardiac related, carry on with the antibiotics. And my wife said, is it worth having an aspirin or anything? And she said, no, it's nothing to do with the heart or anything like that. Saturday night was another bad night, and decided to call for an ambulance, took me into hospital, and gave me some tests and said, you've had a heart attack. And they basically tried to reopen the artery, but because it's been blocked for too long, it was too late to do anything, so I now have a permanently blocked artery. That doesn't affect me in any way, shape or form. I live a perfectly normal life with all of that. But then 6 weeks after the heart attack, I was diagnosed with, well, it was actually a pulmonary embolism, but that's not how that was diagnosed. It was something completely different, but ended up as a PE, and again, time in hospital with all the time on blood anti-clotting agents, etc. So
after you'd recovered from those conditions,
yeah,
did you have a period of stability when you were quite well in yourself?
Yeah, from 2000 up until 2008, I was well. I made it very important that I should go to the gym, so I joined a gym, and I go 3 times, well, I go twice a week, 3 times if I could manage it.
Was that a new thing after 2000?
That was totally new after the, because that came after the rehabilitation.
You had some cardiac rehabilitation program.
Yeah, and enjoyed it so much, met other people who'd gone through the same with heart attacks, and I was encouraged to go to the gym. I went to the gym it was at the Leicester College, and met a lovely person there who helped me through rehab, and she's become a very good friend, and as we're making this video, my wife's out meeting her for coffee at the moment. So
you began to actually get healthier after the heart attack. You were looking after your lifestyle.
Yes, I changed my diet. Not that it was an unhealthy diet. I gave up smoking. I did smoke a couple of cigars a day, and I gave those up, and I just got back to firing on all cylinders.
But then in 2008, what happened?
In 2008, I got these awful pains in the chest, the stomach, the groin, and it was all over, and I just felt really, really poorly. I was lying in bed at the time, on my own in the house, apart from the dog, who was in the kitchen downstairs. And as I was feeling the worst of the pains, my dog was howling, which is something he'd never done before. About half an hour after that, my youngest son came home, and I said to him, can you sort Max out? I think he's, Max is the dog. I think he wants to go outside or something. And I said, when you've done that, can you call an ambulance? I need to go to hospital.
I wonder whether you thought that it was the heart attack coming back.
I did, because the pains were similar. I had no idea that it was anything different from a heart attack, but I was just very, very scared, very scared indeed. My wife came home from work, and he went to the hospital and underwent lots of tests. And after 3 days, that's when I was told it was kidney cancer and completely operable.
It doesn't sound, from what you said earlier, that you were particularly impressed by the way that information was given.
No, I wasn't. I thought it was very cold. And it hit me very, very hard. When anyone mentions the word cancer to you, you think, well, I did say, how long have I got? Because that was my initial reaction.
Did you get an answer to that? Because that's one thing where oncologists and other clinicians sometimes struggle because they're not sure how accurate they can be when they're trying to answer that question.
They said, we're not talking about that sort of thing at this point in time. With kidney cancer, we can get rid of the kidney and that gets rid of the cancer.
Providing it's localised there.
Providing it's localised there, yeah.
But you had further information, didn't you?
I had further information, yeah. I was told that, well, I was referred to a specialist and I had private health insurance, so I went to see a specialist at the Nuffield on Scraptoft Lane, about 200 yards from where I live, and he's confirmed, yes, I got kidney cancer, but he said to me, that's not all. He said, it's also spread to your lymph. And that was like another bolt out of the blue. Said, we can do something about the kidney cancer, but when it's spread to the lymph, there's not much that we can do. And again, I said to him, how long have I got? That was my initial reaction. Because when he said those words to me, it was like he was talking to someone behind me and not me. You know, I thought, well, it can't be me that he's talking to.
Particularly when you'd had reassurance earlier that probably was localised and it would be treated.
That's right, exactly right. Anyway, he said, but there's not much we can do about cancer of the lymph when it's spread to the lymph. And he proceeded to draw some diagrams, which didn't do anything to reassure me. But said, it's unusual to get these two things together. He said, I want to look at the results again. It was 3 weeks after that I got a telephone call one Wednesday night, about 10 o'clock at night, just as the results of The Apprentice were coming in. And he said to me, I've got some good news for you. The other area of abnormality is not the lymph. We think it's pancreatitis, but we need to do some more tests on you. I need to refer you to someone else. So I went to see another specialist at the Spire Hospital this time, and he was the same doctor that I'd seen when I was in the hospital, at the Royal Infirmary. And to be honest, in the Royal Infirmary, I hadn't got time for the bloke. He was very sort of dismissive, and when I saw him as a private patient, I'm afraid the initial reaction was, I don't like you, but then because I was seen as a private patient, it seemed to be an entirely different situation. He couldn't do enough for me, and very dynamic. We need to do this, this, this and this. Come on, you're going for an x-ray, come on, you're going for a scan, and it all sort of happened very quickly. I got the results of that, and they said that I needed to go in for some treatment under local anaesthetic, and basically I had to have a drain, and all I know is that I was laying on my stomach on this table in a side room, and they were draining some stuff out of me. But before they did this, the guy said to me, have you had anything to eat this morning? I said, no. Have you had anything to drink? So I said, no. He said, are you sure? So I said, yes. He said, well, just a minute, I need to make a phone call. So he went off and came back about 5 minutes later, and he said, okay, we'll go ahead. And I said, well, what is it? He said, don't really know. He said, I'm going to put this probe into you, and I must tell you the risks. He said, there's a percentage chance that could make a mistake and things could go wrong. said there's a 0.25% chance that you could die during this. So I said, that means there's a 99.75% chance that I won't. So I said, exactly. So I said, right, go ahead. Anyway, back to laying on the table, all this black fluid was being drained off of me. And there was probably about a litre of the stuff. And when he finished, I said to him, what is it? And he said, I don't know, but I think it's good news. And a few days later, the good news was that it was the fluid that they were draining off of the pancreas, which caused the pancreatitis. Mm-hmm. I was then referred back to the surgeon who was going to remove the kidney, and that would have been about April time, April 2008. And he said, we can't do the operation because at the moment your pancreas is so inflamed, we need for it to settle down because we need to push everything to one side to do it, to do the operation. I said, I'd hope to do it by keyhole. They said, we won't know till we get in there. So he said, but we need to wait for the pancreas to reduce in size. So then I went back at the beginning of June, it would have been, and he said, okay, I've got a date, can do the surgery next week. So I said, well, can I leave it? Because we're going to see Neil Diamond at the NIA, and I don't want to miss that. So I went for the operation about the third week in June, and just before the op, he said, as I explained to you, we'll probably do this by keyhole surgery, but we won't know until we get in there, and you could end up with a great big scar up the back. He said, but if we can do keyhole, I will. Well, he did an amazing job of the keyhole surgery. You can see two very tiny scars now. The day after the surgery, I was made to get up and walk, which I found very, very difficult. But I did it. And the day after that, I was told that if I could walk up and down some stairs and eat a full meal, I could go home, which I did because I wanted to get home. Okay, so I went home on day 3, and for a couple of days I couldn't do much, and my dear dog was after going for walks, so I was able to walk him very slowly for very short distances. And I must say that having the dog did help me, because he forced me to get off my backside and do something. He forced me to go out for walks. If I hadn't have had the dog, I'd have sat in a chair feeling sorry for myself.
It's a useful cue, and it's a kind of form of rehabilitation, isn't it?
Oh, yeah.
Have the dog there and have a responsibility as well.
That's right. He took my mind off of things.
Yeah.
And
sometimes we could suggest that as an actual form of therapy for people who haven't got a loved pet, you know, to invest in getting a pet or a dog,
yes.
Particularly a dog.
Yes, yeah, definitely. Yeah, because as I say, I went out for walks with him, and he made me do things 2-3 times a day. He made me go out for a walk.
People will be interested to know how long it took you to start to feel back to your normal self after that operation.
I think it was probably about 4 weeks, because there was pain from bruising, because I was surprised how much I was bruised around the area where the kidney came out, because I looked at the operation on the internet to see how it was done, and I was amazed that the incision is probably about 3 inches wide, and through there, that's where they push a polythene bag into you, put the kidney inside the polythene bag, cut it off, seal it up and pull it out through that. So the bruising around the lower groin area was quite significant and really quite painful. And I felt I was walking very stooped because of the pain. But I think it probably took about 4 weeks for me to feel that I was getting there.
And what was your view at that stage of how things had gone? Because you'd already been through quite a lot, but things weren't concluded then, were they?
Things weren't concluded, no, but I thought to myself, well, this is it now. Everything's going to be okay. I'm going to get back to normal life and do things, which I did. We continued to go on holiday. We have a holiday home in Norfolk on the east coast, 50 feet from the sea. Last time I saw the place, and we get over there every 2 or 3 weeks for a long weekend with the dog, myself, my wife, and the dog, and walk along the beach, get plenty of fresh air, and that helped me again back to normality. And I felt everything was going very well. Then I had to go back after 12 months from the operation and have a scan, which I did, and went to see the surgeon. This was all still under private health. Went to see the surgeon, and he told me that the results were not exactly as they would have wanted, because I got secondary tumours, multiple secondary tumours in both lungs. And again, it was like I was talking to someone behind me. The guy was a brilliant surgeon, and you know, the scars I have are hardly noticeable, but I think as well as a brilliant surgeon, what he needed was social skills, people skills. Mm-hmm. Because the way I was told that was extremely cold and matter of fact. Mm. He went on to say, it's not a death sentence, but you need to see an oncologist, and to be honest, you're best to come back into the National Health because you get better treatment in the National Health Service. So I took his advice, and he referred me to an oncologist who sent me an appointment letter through, and then I got a phone call from I guess they were the nurses who worked for this oncologist, and they said to me, you need to come in and see Dr. I won't say the name, and I said, what treatment will it be? And they said, well, it will be a tablet form, but that won't be yet. I said, why not? And they said, well, because you're not ill enough. I said, what do you mean I'm not ill enough? How will I know well I'm ill enough for the treatment? They said, well, you'll be anemic and you won't be able to get your breath, and that's when you get your treatment. And that completely turned me off. I didn't, it was something, again, I didn't want to hear. It was an awful experience, and I think that was probably the time when I was nearest to what could have been the start of depression, fear, anxiety, you name it. I just felt, you know, how long have I got? Anyway, I decided to explore other avenues and went for other treatment abroad, which actually helped me in a lot of ways, because I was able to leave off some medication that I'd been taking since my heart attack. I'd also got medication for hiatus hernia, and this chap helped me with diet and gave me some supplements and some other treatment, which helped me to leave off a lot of the medication I had been taking.
I'm guessing you're quite a proactive person regarding your health, because that's quite a bold step to go abroad and find further advice.
It was my son that did that. My eldest son, he'd bought a book. The book was The Hidden Cure by a guy called Lawrence Mars, and he is based in Barbados. My son bought the book anyway, and shortly after I had the experience of being told I wouldn't get the treatment until I was ill, really ill, my son put the book down, and it seemed to fall open at a page where this guy had been treating people with cancers. My son took the bull by the horns and got in touch with this person, with Lawrence. And Gary, my son, said to me, "You've got to ring Barbados tomorrow morning and speak to Lawrence," which I did. And he said to me, he get lots of questions, etc., and said, "I can't guarantee you a cure," he said, "but what I can say to you is within 3 months I'll have you feeling better if you can get over to me for treatment." So, cutting a very long story short, we did go to Barbados, myself and my wife, and that introduced me to the Caribbean, which I now go to frequently. I love it. Saw Lawrence for treatment. That would have been in August. I then went back to see him in September for some further treatment, and then again in November for further treatment. And true to his word, I was feeling an awful lot better. I also decided, if I just turn the clock back a bit, when I was told about the secondaries in the lungs, that I decided I wasn't going to tell anyone apart from the family. Because what I didn't want was people saying to me, "How are you?" But how are you really? I didn't want sympathy. I wanted to remain as positive as possible, because I wanted to fight this, and I wanted to fight it damned hard. Nothing was going to get me. I wanted to carry on going to the gym. I wanted to carry on with a normal lifestyle. I wanted to carry on going on holidays, carry on walking the dog. I was going to fight this.
You know what?
That was important to me, to fight it.
You maybe didn't want too many negatives or too many reminders.
That's exactly right. I wanted to deal with it in my way. So the only people who knew were my wife, my sons, my brother in London, my brother in Leicester. I didn't tell my mother because she was in a nursing home. She needed constant care in a nursing home, so I hadn't told her. And that was it, really. I just kept it a very close family, didn't tell friends, apart from my wife told this lovely girl who I met at the rehab, who'd helped me through the heart attack, because she'd become a close friend, and she was very understanding and very helpful. Not the sort of person who'd be over sympathetic, but a positive person. So that's the way we decided to handle it, and that's the way we did handle it, because, as I said, I didn't want sympathy. I wanted to get on with life and kick this in my way.
And do you believe that was the right strategy now, in retrospect?
For me, yes. Yes. I think the most important thing is to have a positive attitude. I wanted to know that I could beat this. And that's what I would encourage other people. You can beat it. It is beatable.
That's encouraging that you say that, because your disease has been quite aggressive in some ways, particularly with the spread to the lungs.
That's right, yes. I'll pick up the story again now in at Easter time, 2009, where I went to the gym on a Friday morning. I was parking my car, and I suddenly had a feeling in my stomach of I wanted to vomit, and all it was blood that I was bringing up. So I went home, decided not to do any gym work that day. Went home and didn't say anything to my wife initially. And then a couple of days after that, I bought some more blood up, so I thought I'd better go and see the GP. He sent me for an immediate X-ray, and a couple of days after that, got the results, and he said to me, "You must go and see an oncologist." And I said, "Okay, but anyone other than the initial oncologist who I was referred to through the NHS." And he referred me to Dr. Simons at the Leicester Royal Infirmary. I went to see him, and with great trepidation, the first appointment, I was sitting in the waiting room for about half an hour waiting for my appointment to be called, and I very nearly got up to go because I couldn't stand it. Lots of people sitting there waiting for appointments, and some not particularly nice sights with some people who were looking very, very ill. I thought, I don't look like that, I'm not like that, that's not me.
I think it can be difficult in those waiting environments, and also sometimes on the chemotherapy suite when there's a lot of people around.
That's right.
I sometimes wonder whether we could organise a better system, because it is possible to meet with people therapeutically where to benefit, but sometimes haphazardly doesn't work that well. It depends.
That's right. When you see people, I'm very fortunate with the chemo that I had, there was nothing visible. I hadn't changed my appearance at all. But where you see some of the people who are extremely gaunt and without hair, that becomes scary when you think that could be me. I wanted to walk out of that, away from that first appointment, but I didn't. And I met Professor Simons, who is now Professor Simons, not Dr. Simons, and I warmed to the guy straight away. He answered every question, very forthright. He was very truthful. I just trusted him. And he said about the medication that I'd be taking, a tablet called Sunitinib, and that it was fairly new. They were getting good results from it, and he could put me on that, and I'd have 4 weeks on and 2 weeks off. Thought about it, and really it was a no-brainer, and went for it. And after 3 months of treatment, I had a scan, and more of the Sunitinib, and I've been on the Sunitinib now for nearly 2.5 years. Back in May this year, I had a scan which showed that the tumours had all but disappeared. There were 2 very small shadows, less than 5 millimetres, one on each lung, which Professor Simons said could have been due to a childhood illness. But they put it down as having a complete response to the Sunitinib.
Let me ask you about that treatment with the Sunitinib.
Yep.
You, I think, had some complications, i.e. side effects from that drug.
Yes, that's right. Initially, side effects were mouth ulcers.
That can be very unpleasant.
That can be very unpleasant, and I was given some, I think it's called Diflam, which is like drinking antifreeze. It just froze your mouth. It was awful stuff. But then it was suggested to me that I should rinse my mouth with salt water, which I did, and within a couple of days that cleared my mouth ulcers. So whenever I got mouth ulcers, it was a mouthwash of salt water, which cleared that up very quickly. I had a feeling of nausea, which would come and go, and I was given domperidone for the nausea, and that cured the nausea. I had gastric reflux, which was really bad at times, burning in the chest area, and lansoprazole was prescribed for that, and that helped with that. One of the other side effects I got was very, very badly chapped hands, very dry skin. My hands would get sores on them, and I tried all of the proprietary hand creams but nothing seemed to work. And Professor Simons said to me he'd heard of udder cream. And so he didn't know much about it, but he'd heard it was good. So I got home, went onto the internet and Googled udder cream, found it on Amazon, sent for it, and it's amazing. It solved the problem within days.
Wow.
Very, very good stuff, and extremely cheap. A big tub was about £7. So there's no need to suffer with that. When I came off the Sunitinib for my 2 or 3 week breaks, it would either be 2 weeks or 3 weeks, depending if I was going on holiday. Again, Professor Simons was always very flexible. If I wanted to go away, yeah, we can give you a 3 week break, no problem. When I was off the tablets, the side effects would go away and they would start again either a week or 2 weeks into the next session of medication. Last November, about a year ago, I started to get some really bad side effects, and that seemed to coincide with when the tumours were shrinking the most. So it was almost, and I asked the question, if the tumours are reducing in size, what is the medication attacking then? Anyway, we kept on with the medication and had a scan in May of this year, as I said, and it was diagnosed. I was told it was a complete response, but they wanted to keep me on the Sunitinib because there was very little experience of people coming off of the Sunitinib. The side effects kind of became worse, and about 5 or 6 weeks ago, back in October this year, I had some really, really bad side effects. Trapped wind. Now, trapped wind doesn't sound painful, but believe me, I couldn't sit, I couldn't stand, I couldn't lie down. I had pains in my chest, pains in my back, across the shoulder blades, up into the shoulder blades, up into the head, and into the bottom jaw. I couldn't belch, I couldn't break wind, and I couldn't even breathe in properly. Every time I took a breath, I got a pain in the right-hand side. Food was getting stuck as I was trying to eat.
So it was becoming very difficult to tolerate being on it.
Yeah.
Especially when you'd had a full response.
That's right. That's right.
What did you decide in the end?
I decided that as the lansoprazole and the domperidone and everything was not giving me the relief, I tried peppermint water, which again did give some relief, but it wasn't curing. It gave some relief. Painkillers weren't working, and I really didn't want to take any more tablets because I didn't want to put any more poisons in my body. I rang Professor Simons to see whether I could take Gaviscon, whether that would interfere with anything, and was told that it'll come back to you. I got a phone call about an hour later and was asked to go back in to see Professor Simons the following afternoon to have a chat. So I went in, and I'd been called in because there was a concern that with the pains that I was getting, it was probably the onset of pancreatitis again, and they wanted to do a blood test to discount that because pancreatitis, as I was told, can be a very serious illness. He said that if it wasn't pancreatitis, then I would come off of the Sunitinib, and that scared me a bit because it was like a kind of a crutch. I knew that the Sunitinib had killed off the tumours and was worried if I came off the Sunitinib whether they would recur. So I quizzed Professor Simons, and he said, no, don't worry, if we take you off the Sunitinib, you'll be monitored very, very closely. So got the phone call the next day to say it wasn't pancreatitis and to leave off the Sunitinib. And I've been off of that now for 5 weeks. Still get the side effects, but nowhere near as bad or for anywhere near as long.
Have they been generally decreasing?
They are generally decreasing. I've had nothing now for over a week.
Oh, that's good.
I had a scan a couple of weeks ago, and today is Tuesday, and I've got an appointment with Professor Simons for the scan results on Thursday.
Fingers crossed.
Fingers crossed, yeah. I mean, I feel great. When I'm not having the side effects, I wouldn't know there's anything wrong. I still go to the gym twice, 3 times a week. Haven't been for the past couple of weeks. I've been a bit naughty. We've been on holiday. I'm trying to get back into it. But life is normal.
It's quite remarkable, given all those steps that you've been through today, that you sit here now, and if somebody met you for the first time, they probably wouldn't know you'd been unwell.
It's funny you should say that, Alex, because when I told people, I said I didn't tell people that I was having treatment. Once I told people, when I told my neighbours that I've been having treatment for 2 years, they would just said, I don't believe you, because you look so well. And because people told me I looked so well, that made me feel even better. That made me feel more positive, that I'd been fighting it.
Yeah.
Okay, there are times when fighting was hard, but my wife is extremely supportive, my sons are extremely supportive, and they've helped me. I couldn't have done it without them.
Definitely, it's important to have those immediate sources of family support if it's available to you.
Yes, my oldest son would always come to the hospital with me for appointments to see Professor Simons, particularly the scan results. My youngest son would want to know straight away what was going on. Terrific support. My wife and my sons, I can't speak highly enough of them. As I said at the beginning of the video, we've got an extremely close relationship. In fact, in September this year, myself and my oldest son went for a week in the Algarve together. We tried to get the youngest son to come, but he couldn't because of work commitments. But that's how close we are as a family.
Now, looking back on everything you've been through, is there anything else that you've thought that's helped me get through it? Either something about your outlook or people around or resources that have come up? The
people at the Royal Hospital, and probably the same at other hospitals, I don't know, they're superb. The nurses there are fantastic. Professor Simons is wonderful. I promised him actually when I first saw him that if he could get rid of my tumours, a nice bottle of whiskey for him. So when I leave here, I'm going to get him a nice bottle of whiskey for the appointment on Thursday. That's important. Having supportive people around you, a supportive family is important. Having a positive mental attitude, I think, is perhaps the biggest key to it all.
And you were able to maintain that throughout. Did you ever find times when that was shaken?
Probably when I had some of the side effects. I got a little bit scared with some of them. But I kept myself going by thinking, well, hang on, these are the bad sides, but look what it's actually doing. I can put up with a day or a few hours of pain because I know it's killing off the bad guys, the tumours.
And did you find it able to be positive? You were able to be positive when things were uncertain? You know, really, we could say everyone's in an uncertain position to some extent. Yeah. Even if you have some good news, we don't always know how long that's going to last. Is it important still to be positive, even when things are not clear?
Yes, last year, my brother, my oldest brother who lives in London, had been diagnosed with pancreatic cancer. And we were close despite the miles, and that hit me very hard when he died. I saw him just about 4 to 5 weeks before he died, and I wanted to go and see him again about a couple of weeks before he passed away. But he said to me, because I got a cold, I said, I don't want to come down and bring a cold to you, Brian, because your immune system is going to be shot to pieces. I don't want to leave you with a cold. So I said, no, leave it till after Christmas, mate, you know, don't worry, leave it till after Christmas, I'll see you then. I didn't know at the time that he'd said that to me, that the day before he'd been told he'd got days left to live. My brother was a very positive person. He fought to the end, and my mother passed away August of last year, and Brian was one of the executors, and he was determined to sort out the estate and everything before he died. And having that to do, and he was a belligerent person as well. Everything was a major problem to him in a positive kind of way. He had his own business, and he would rant and rave, and we would get on the phone and rant and rave about politics and whatnot together. And that kept him going because he was a fighter. He was a fighter. My mother was a fighter. My mother was diagnosed with multiple sclerosis in her 30s. And she was 80 when she died. She was a fighter. And I guess it's bred into me to fight.
You've introduced something else there, which is the importance of having a role or a purpose, like your brother had in those late stages. And I think that can be key for people as well.
Yes.
To not just exist and think that every day is the same, but to try to make life meaningful still, even if you're held back to a certain extent by your illness.
Oh, exactly, yes. One of my other hobbies is going to concerts, rock concerts, and I wouldn't hesitate in booking something months, even a year in advance, because, you know, as far as I was concerned, I was going to go to that. And I also had bought myself a sports car, and in March of this year I bought myself a brand new Audi, because I was going to use it. I was going to be here to use it. So yeah, these things, you've got to look forward. There's no point looking back, if only. You just waste time doing that. Concentrate on looking forward and being positive. You can do this. You can fight this. You can beat it. Because as far as I'm aware, I have beaten it.
Well, that's an inspirational note to give out to the viewers, particularly people, you know, who are newly diagnosed, they're uncertain, hearing everything you've been through, with setbacks along the way, we must say, but yet coming through it, and you know, at this stage, looking good, feeling good in yourself, and wanting to face the future, wanting to carry on. That's a great inspiration for everyone.
Exactly. Yes.
So thanks for coming in today.
You're very welcome.
Thanks for sharing your story.
You're very welcome.
And all the best for that follow-up next week, and best for the future.
I'll come back in a few years and go through the story again if necessary.